All right, so we are talking a little nature versus nurture. This straddles the line a little bit, but you've got this new survey and the impact of environment on our health and our chances of dying, I guess.
And how does that relate to our genetic risk? So a lot of people want to ask, what matters the most? Our environment, what we do in our daily life, or our genetic risk, our DNA? What translates to our risk of outcomes in terms of heart disease, liver disease, and overall our risk of death? In this new study, they looked at over 500,000 participants, looking at over 20 different environmental factors. Do we smoke? Where we live? How much we eat? And also our genetic risk factors, and it found that our environmental risk factors were the most indicative in terms of our outcomes of most of our health factors. For example, heart disease, liver disease, lung disease, and even reducing our risk of death.
So does this mean there's actually something we can do about it?
Yeah, I think that the most important part here is that there are factors that we can modify. Number one, smoking is a big risk factor for disease. We've already discussed that, but physical activity is one of those huge risk factors. Getting in that walking wherever you can, whether it's having your favorite TV show when you're going on a walk, walking your dog, getting in 10-minute workouts throughout the day, those can have real discernible benefits on our health.
I could see this actually being good news for people who think, well, my parents, my grandparents suffered from the same thing, so I'm doomed, right? It seems like maybe we're overestimating the genetic impact.
Yeah, it's not inevitable, and most of it is preventable. There are certain factors that are associated more to genetics, breast cancer, ovarian cancer, but I think what's most important is your overall quality of life and your risk of death can be reduced if you make changes each and every day. Getting physical movement, making sure you're mindful of your diet, controlling your cholesterol, being mindful of your blood sugar. This is how we improve our quality of life as we get older.
So you can't blame your family.
Yeah, that's a lot easier.
Not blame your family. That's a lot easier, but you shouldn't do it. Get out there and walk.
Okay, fair enough.
Thanks, Dr. Darien.